reading of the amendment is dispensed with, and the gentlewoman is recognized for the purposes of explaining her amendment.
Well, thank you, Mr. Chair. I'm proud to lead this amendment to expand access to assisted reproductive health services, such as IVF, to all service members who become seriously ill or injured in the line of duty, including LGBTQ+ service members and unmarried service members. As the proud sister to a trans brother and a gender nonconforming sibling, the proud representative of Hillcrest and North Park, the heart of San Diego's LGBTQ+ community, and as an unmarried woman myself who recently used reproductive preservation care, leading on this amendment is deeply personal. So right now, TRICARE provides health coverage for assisted reproductive services for service members who become seriously ill or injured in the line of duty. This is a policy I strongly support. But the provision of these services is guided by a 2012 policy guidance memo that excludes service members who require a third-party donation, using eggs, sperms, or embryos from someone else in order to help an intended parent or parents have a child, or surrogacy services, including service members who choose to have a child without a partner, and many LGBTQ+ service members. The bottom line is that this policy discriminates against seriously ill or injured service members on the basis of marital status, sexual orientation, and gender identity. The current guidelines are so restrictive that military members who have lost their reproductive organs due to a service-connected injury do not qualify for coverage for IVF because third-party donation is excluded. As members of Congress, we have a moral obligation to ensure the highest level of family-building support for all those who have sacrificed so much to protect the health and safety of our country, especially all of those who became seriously ill or injured in the line of duty. My amendment would begin to bring DoD's family-building policies into the 21st century by extending assisted reproductive health services to service members who require a third-party donation and surrogacy services, regardless of their marital status, sexual orientation, or gender identity, effectively undoing our current policy that shamefully shuts out service members who would otherwise qualify for this vital coverage. So just to give you an example of who is not currently covered, if, for instance, a married man who was married to a woman, was serving in the Navy, was injured, and could no longer produce sperm, and he and his wife needed a sperm donor, that would not currently be covered under this guidance. If a married woman who was married to a man serving in the Marines was injured and could not carry a child herself and needed a surrogate, she would not currently be covered. This amendment fixes that. I strongly urge my colleagues to support this amendment. Thank you, Mr. Chairman. I yield back.
Thank you.